Hello friends, today we will be discussing a very important and a useful topic. We will be discussing about diet in valvular heart disease patients. A lot of patients have valvular heart disease problems, but there is no clear-cut guidelines as to what diet they should be on, because most of the times valvular heart disease patients ask us whether they should take less oily food, less junk food, less spicy food, less salt, less water, less cholesterol containing food, whether diet and cholesterol related restrictions which are applicable for coronary artery disease patient, whether the same thing is applicable for valvular heart disease patients. This is a very common question which a lot of people ask us, and this is something which has seldom been discussed in routine contemporary cardiology practice. So today we will be discussing about valvular heart disease patients and pertaining to the diet in these patients. Usually valvular heart disease patients can be categorized into rheumatic heart disease and senile congenital valvular heart disease, or sometimes they might be congenital valvular heart disease patients also. Rheumatic and congenital heart disease patients will have similar sort of valvular issues because their age group is similar. Congenital heart disease presents from birth. Rheumatic heart disease usually occurs in the age group of 13 to 15 years, 17 years. So they are also in early ages. While senile valvular calcific aortic stenosis or valvular stenosis or valvular lesions usually are seen in elderly patients, usually beyond the age of 50 to 70 years, and most of their dietary restriction will be slightly on the different type. Cholesterol related restrictions usually are not applicable to valvular heart disease patients, especially those having congenital valvular heart disease patients and those having rheumatic heart disease patients, because this disease is not related to cholesterol. Any restriction in cholesterol, any restriction in diet and sugar is not applicable to these patients because these diseases are not related to dietary cholesterol levels. Usually these are diseases which are associated with coronary artery disease patient, which is an entirely different disease subgroup. If at all any patient having a congenital or a rheumatic heart disease does have these diseases simultaneously, that means the patient is diabetic, hypertensive, or is having any coronary artery disease, then there are chances that the patient will be put on this type of dietary restrictions in terms of cholesterol, sugar and oily food intake. But usual valvular heart disease patient where there is no other admixture of any other disease pathology, the patients should not be kept on cholesterol restriction because it doesn't serve any purpose. Fluid restriction and salt restriction are usually seen in patients having heart failure along with valvular heart disease. Most of the valvular heart disease patients, especially when they are having severe valvular pathology, they present to us with symptoms of heart failure. Symptoms of heart failure are usually related to extreme volume congestion, which is seen in these patients. Once these patients develop volume congestion, these patients are advised to take more amount of dietary restrictions in terms of salt restriction and water restriction are advised to these patients, because if at all they take more amount of salt, that will retain more water and the lungs will be flooded with water and the patients will have more of dyspnea. If at all the patient takes more of water, the water will directly flood the lungs and it will cause dyspnea, because this extra vascular volume cannot be tolerated by that valve, which is either narrow or regurgitate or leaky. Valvular pathologies are usually of two types. Either the valve is narrow, which means excessive amount of blood is pushing through a very narrow orifice. That is why we need to reduce the pressure of the blood and reduce the vascular volume, and these patients are advised to be there on a low salt and low water diet. Similarly, the patients having a leaky valve, they are having excessive volume regurgitation or excessive leaking. That is why the heart is over flooded with extra volume. So these patients are also advised volume restriction and salt restriction. These restrictions may not be applicable to patients having very mild form of valvular heart disease, that is mild or moderate stenosis or regurgitation. These patients need not keep the salt and water restricted. But once the patient goes into the level of severe stenosis or regurgitation and the patient starts to develop symptoms of heart failure, then it is much more likely that these patients should be kept on salt restriction and fluid restriction. Other common question which the people ask us is whether the people having senile valvular heart disease or calcified valvular heart disease, these patients have excessive calcium deposition of the valves, which makes the valve hard and does not allow the valve to have the normal mobility, or valvular opening and closing will be compromised. Whether these patients should be kept on a calcium restricted diet is a very common question, but calcium restricted diet is not very useful in these patients, and studies have shown that rather the patient who are deficient in calcium and the patients who are having a low amount of vitamin D in their bodies, they are more likely to have vascular calcification. This deposition of calcium inside the valve or on the surface of the valve is not related to the dietary calcium. That is why dietary calcium restriction is not advisable in these patients. Vitamin D intake also should be normal in these patients, because some studies have shown that low vitamin D might lead to more calcification. These patients are also advised to take diet containing high amount of vitamin K2, which affects the calcium metabolism of the body, although this is usually available in the form of medicines, because isolated vitamin K is usually associated in green leafy vegetables, but K2 isolate is not available in routine fruits and vegetables, so that can be taken in the form of vitamin K2 pills. Although there is no clear-cut consensus and data that vitamin K2 agonists will help in calcific valvular heart disease patients, but they may help to a certain extent and they can be recommended because no other medicines might be useful in these patients. Patients having senile valvular heart disease are usually advised restriction in terms of cholesterol, sugar and oil intake, because most of these patients also have some calcification inside the coronaries, and coronary artery disease is also present in most of these patients. That is why these patients will be advised to keep less of oil, cholesterol and sugar in their diet. But if the patient is having an isolated valvular heart disease, then there is no coronary artery disease, then they may or may not keep the salt and cholesterol restriction in these patients is recommended. Severe valvular heart disease patients having severe problems will be advised fluid and restrictions similar to congenital and rheumatic valvular heart disease patients. What is the importance of fluid restriction? Obviously, if the patient is having severe valvular heart problems with heart failure, he will be advised fluid restriction. This fluid includes tea, coffee, juice, whatever fluids the patient is taking for the entire day. A lot of people ask us whether the patient can take juice or milk or buttermilk instead of the routine water, but that is completely wrong, because all sorts of fluids should be counted and they should be added up. If at all the valvular problem is very severe, then the patients are advised to keep the entire fluid restricted to 1 liter per day, which includes everything. If at all, even if the patient is taking 200 ml of fluid or tea or coffee, that also should be subtracted from the entire 1 liter for the which is available for the day. So the patient has to be kept on a strict fluid restricted diet, which includes all forms of fluid which the patient is taking. Similarly, salt restriction also should be very strict in these patients, because most of these patients should be advised salt restriction, and they should keep the salt restricted to less than 2 grams per day, which is very low, almost less than 1 small teaspoon of salt for the entire day, which includes all the salt which is used in cooking the fruits and vegetables also. Then what are the restrictions for the patient who are having arrhythmias or patients having atrial fibrillation? Patients having arrhythmias or atrial fibrillation are put on vitamin K antagonist, because atrial fibrillation is a condition which leads to increased clot formation inside the heart, and the clot can migrate to the brain or to the peripheral organs and may clot the vasculature. If it goes to the brain, it will suddenly occlude the brain vessels and the patient will suddenly develop a brain paralysis. So these patients are put on vitamin K antagonist, and these patients are advised to take a diet which is low in vitamin K containing products, which means then green leafy vegetables like kale, spinach, turnip greens, collard, Swiss chard, mustard greens, green leafy lettuce, all these fruits and vegetables which contain large amount of vitamin K should be restricted. Brussels sprouts, broccoli, cauliflower, cabbage, everything contains a lot of vitamin K. Some animal food like fish, liver, meat, eggs and cereals also contain vitamin K, but in comparatively smaller amounts. So these foods should be kept in a restricted quantity. I do not recommend that the patient should completely stop all foods containing vitamin K, because a lot of doctors do advise in this way. But what I feel is better for the patient, that they should keep the vitamin K containing products on a restricted quantity. They should calculate the total amount of vitamin K which they are taking for the entire month. They may take all these foodstuffs maybe 3 or 4 times for the entire month and keep that on a restricted way. They should count it every month. It should not be like 1 month they are taking 20 times and 1 month they are taking 2 times, because if at all they are taking green leafy vegetables 20 times in 1 month, that month the blood will be extra thick and there will be more clotting in these patients, because more vitamin K will be produced in these patients. Secondly, if the patient is taking very low amount of vitamin K containing foods for the entire month, that means maybe 1 or 2 times for the entire month or 0 times in the entire month, then the blood will become exceedingly thin and the patient will start bleeding. So the patient has to keep these things in a restricted way. Either the patient doesn't consume it at all, or if it is the patient is consuming these vitamin K containing foodstuff, he has to keep it in a restricted way and he has to take it maybe 4 to 5 times in 1 day. What are the restrictions for patients having coronary artery disease? If at all it is present, along with obviously less oily, sugar, salt containing products should be kept similar to any other coronary artery disease patient. If at all the patient is having any kidney disease problem, then any foodstuff which is containing potassium, that should be restricted, and any foodstuff which is having high cholesterol also should be restricted in these patients, because lot of kidney disease patients also have coronary artery disease coexisting in these patients. What should be the diet in patients planned for surgery? If at all the patient is planned for a surgery, the patient should take more of dietary proteins and more of calcium, because in the surgical period, in the perioperative period, dietary protein and calcium might help in healing of the wounds and the surgical scars. So if at all the patient wants dietary protein, he can take animal proteins like fish, eggs, meat, any forms of lean meat can be taken by these patients, or the patient can take vegetable proteins in terms of lentils and beans and sprouts and soya bean, whatever food products will contain high amount of proteins. These can be taken by the patient. In terms of calcium, the patient can take more and more of dairy products like milk, cheese and buttermilk. These will contain high amount of calcium, so this will help in healing of the wounds. The other form of dietary restriction in post-surgical patients, if they are on blood thinners, will be the same as the patients who are on blood thinners prior to surgery, and other forms of dietary restriction in terms of heart failure will also be the same in patients having surgery done, if at all the pump function is bad. For patients who are having a good pump function after the surgery, if they are not on any blood thinners, they will not be put on too many dietary restrictions. But if at all the patient is having significant amount of heart failure, then the patient ideally should be put on similar dietary restrictions which are present prior to the surgery, because these restrictions are related to the coexisting pathologies, like the patient is having kidney related problem, coronary artery disease problem, arrhythmia related problem, or the patient is put on vitamin K antagonist, then or heart failure, then the same dietary restriction should be there, which we have already discussed, and the dietary restriction will not stop. What should be the dietary regimen in patients having tissue valve in comparison to metallic valve? Patients with metallic valve will be put on lifelong blood thinners, so vitamin K antagonist should be put on these patients for lifetime. That is why any foodstuff containing vitamin K like green leafy vegetables and all, which we have already discussed, they should be kept in a restricted amount for the entire life in a patient having metallic valve. While in a tissue valve, the patient is usually kept on anticoagulants for the first 6 months after putting a valve, until the time the patient develops an endothelial layer on the tissue valve, after which the blood thinning medication is not required. So the restriction on green leafy vegetables will be restricted in the patients having tissue valve within the first 6 months. Beyond that, if the patient again develops atrial fibrillation, which will indicate that the patient is put on blood thinners and vitamin K antagonists, then the patient will be put on the same dietary restriction as compared to the patient who is having any who's put on anticoagulation prior to surgery or with any other valve pattern also. Patients with atrial fibrillation who are put on newer anticoagulants, they should also keep restriction on the foods containing vitamin K, although the restriction may or may not be as strict as compared to the patient who are kept on acetrom and warfarin. In this topic, we have discussed about the dietary restriction of the patients who are having valvular heart disease. This is a unique topic because most of the people have never discussed this topic, and I have never seen this topic or dietary restriction pertaining to valvular heart disease patient anytime discussed on any other channel or by any of the cardiologists. So this is a very unique topic which people should understand. If at all you have any comments, queries or suggestions pertaining to this topic, feel free to ask us in the comment section below. We will be happy to solve out your health related queries and problems also. If at all the people who are new to my channel, I would request them to subscribe to my channel, as this gives us a lot of inspiration and motivation to continue the channel in future. The people who are not interested in huge amount of technical details, for them we are regularly uploading YouTube shorts or short videos in 1 minute, where we give a brief summary of all the topics which we have discussed. The salient features of all the topics are available in this, and they are connected to all the playlists which are available on my channel. Whatever disease you are having, maybe BP, sugar, cholesterol, heart attack, heart failure, angioplasty, valvular heart problems, you can go to the specific playlist, and on that playlist you will find much more relevant content, and you will not have to keep searching for the relevant content. Thank you.